Anna, you can go ahead and start recording.
Started.
Thank you. Good morning, everyone. This is the MnCHOICES MCO and MCO delegate call-in session for February 21st, 2024. I know we'll see others rolling in, but I wanted to make sure that we had most attendees coming in before we go ahead and get started. So on the list in front of me or in front of you on WebEx is the team that is present for today's call. And so they will, when they speak, introduce themselves so that you know who's answering your question. But this gives you a list for reference. As you know, this session is being recorded. We use web audio you'll use web audio to listen to the session. You're all muted, and we're going to ask you to raise your hand to ask a question, and we'll call on you and unmute you. And for these sessions, we really don't want you to put your questions in chat, and we will ask you to ask them out loud because we want the chance to have a conversation about the question that you're asking to ensure that we have the nuances of it and can answer it as with as much detail and with what you need to do to resolve your question as possible. So our agenda is a really short one today, which is why I kind of waited to watch the attendees list go up. We don't have any new items to discuss, and so what's going to happen is we're going to go right to questions. So I'm going to move to questions, and you can see in front of you, we're going to try to go in order: HRA assessment support plan and all other questions, and take about 20 minutes for each. If there aren't any HRA questions, then of course we'll move on. If your questions are more nuanced and kind of are about all three, please try to hold off until the one that's most predominant. But we will start today with, do folks have HRA related questions that they would like to ask? And as people are all coming on, just please go ahead and raise your hand.
All right, Teresa, it looks like our first hand raised is Anne Marie. I will unmute your line.
I had a quick question for the HRAs. If we have a member who is in their 90-day grace period, MA has already closed, but they are due for their annual HRA during that 90-day window, will the revision allow us to enter that refusal or unable to reach or full HRA form while there is no MA, while the MA is showing as closed and inactive in the system?
This is Sue. Teresa, and I believe that you will be able to do so because I think so, right, Teresa? Because MnCHOICES isn't necessarily because assessments get done for people who are not on MA. I don't think
if you want me to
it.
speak to the functionality piece, the system will allow you to create an HRA form and even complete the form without having that MA status.
Okay, wonderful. Thank you.
We're all starting this call a little early in the morning, and we didn't give you much time to get prepped for questions. So we're entertaining HRA questions. If there aren't any others, we'll move to MnCHOICES assessment, but I'm giving you just a few more minutes to put your thinking caps on in the morning and say, is there anything else that we would want to ask about HRAs? So.
All right, Teresa, and it looks like our next hand raised is Ricky. Ricky, your line is unmuted.
quite a few questions in regards to refusals. So technically they are documented under the HRA MCO, and you select member has declined the assessment. And then also with unable to reaches, same thing, you select HRA MCOs. So the main question pertains to the unable to reach, and when that is completed, I believe there was some training material that said each time they went in to complete the assessment, they had to enter a new one. However, with that being more cumbersome, we had provided some direction that the assessment date should be, obviously the date of the letter that they send out, but that they could document their attempts within a progress note for those unable to reach us if they're doing it in the application. Is that going to affect any of the reports?
So is your question, if things are in progress notes, does that data get reported to MCOs?
So
Is
part
that,
of my
yeah.
question, it really isn't not the data to us, but the data for you guys to track assessments completed. So for us, an assessment isn't truly completed until they've made all their outreach attempts, and then they would send out the letter, and that is the date of activity. And that's the date we want them to enter as the assessment date. However, I think there was some communication provided from DHS that each time they go in to enter um, and unable to reach. So let's say I reach out to you a total of 4 times. So each time I do it, I need to enter a new one every single
I think
time.
that was because MCOs needed those dates to track for CMS purposes to show documentation of attempts.
Okay, so if we
That's,
provided,
and so and that's why I asked the question, because I don't believe progress notes is necessarily data that flows to the MCOs. And DHS does not track those attempts. Those attempts are for CMS purposes, I believe.
okay, all right,
We
thank
just
you.
track the unable to locate. And if that
Okay,
is in there, we count that date for DHS's HRA. My understanding is that for CMS purposes, there needs to be tracking of the 3 attempts. And so we had indicated to get those 3 dates, you would need to do the 3.
okay, so if we've provided a way for them to capture that data and that meets with us, like we can go look up that data if it gets pulled for an audit, then that would be okay, is what I'm hearing you say.
Yeah, if you get that for your reporting purposes, I don't know how you're going to get that because you would have to look it up manually. But if that's what you're doing for your CMS
Perfect.
reporting, I don't know how you're collecting data. I mean, you would have to talk to your reports people. But
Yep,
that
that
was,
answered my question.
yeah, it was based on how people wanted that data to flow with those 3 different dates.
Perfect. Thank you.
Sure.
Okay, the next person I'm going to call in is Trista. Trista, your line is unmuted. Oh, I just see Trista lowered her hand. So I'm going to move to Lena. Lena, your line is unmuted.
Yes, we can. Go ahead.
Oh, perfect. Hi, good morning. So I have a couple questions, but I can start with my first one is for assignment purpose. So I'm with an MCO. So for assignment purposes, we have noticed like if we're assigning ourselves today, for example, and we have an assessment, due today for someone, we're noticing that the health insurance information isn't populating in right away. Necessarily, or like the PMAP status isn't showing, and sometimes staff has created the form for the MnCHOICES and the support plan and like completed the assessment and whatnot, and then it eventually shows no health insurance information. So I guess I'm just curious if that's a known issue, if we should be waiting a certain amount of time for that data to load overnight, or what that kind of looks like.
So from a functionality standpoint, if you're adding a new person into the system, it will take overnight before that information gets loaded. So if you're specifically talking about a MnCHOICES assessment, the health information some health information needs to be there. So it can't be no information in the health insurance screen. Because like you said, then you won't be able to edit information. For the HRA, that if you create an HRA and there's no health insurance information, you can go ahead and proceed.
Okay, so, and when you're saying no health information, you're saying it's either it's completely blank in that section or there's no PMAP listed for us as an MCO.
I was gonna go log into MTZ so I could show you what it looks like. We've provided slides on it in the past. Sorry, it's anytime I am working to log in. Of course, it has me logged out because of timeout. So let's see if this gets me to MTZ. And I'm sure all my folks are going to have health insurance, so we're just going to pick somebody and I'll tell you what I'm speaking about. So if there is no health insurance information, this screen will populate no information. It'll just be a little window that says no health information available.
Correct.
Okay, right? And so if it says that and you're creating a MnCHOICES assessment, you can't then go in and edit in the assessment fields the updated information. So you then do have to wait overnight. If you're working on an HRA and it says no health insurance available, you can move forward with the HRA.
Okay, so if I'm hearing you correctly, say we shouldn't start creating forms like the night before, like we shouldn't start forms prior to it loading overnight if we're doing a MnCHOICES, correct?
Correct. Yep, because the reason for it is, here, I don't have any forms for this person, is because see if I can find somebody who's got something. Go. I can look at this one. I'll check this form back in. I'm not as adept at this as you guys are, so it takes me a little bit. But there's a section in here anyways, where you can edit I'll pick a different person since this one's got a checked out one, where you can edit once the health insurance information populates in the health insurance information screen, and you create an assessment, it will pull over the data that displays at that time, but in the assessment you can edit it. So if it says MA status unknown and you now know they have MA status, for example, then you can pick MA status. For MCOs, that doesn't probably make sense because they will have MA status likely, but
Right. So
but at least
what I noticed with one of them is that, you know, the staff had entered in on 2/6, for example, and they opened the assessments on 2/6 and they did their assessment then on the 9th, that Friday. They opened it and pre-filled in stuff, and then they went in on the 9th and finished out everything, met with the member and all that. And then when they went in to do results, they noticed that in their assessment setup tab, I think that you were just in, or wherever it was,
Yep.
it said like no health information at all available, even though the health information in the profile section, like on the left, had populated in, but we noticed that the date was after. It was an overnight date. It was like, yeah, it was the date after they created the profile.
Yep, and that is exactly how you're going to notice it. So what's going to happen is they're going to create the form, and this page will say no health insurance information available. You'll get it the next day and you'll see the health insurance information. You'll go work on the assessment and you'll say, heck, in that section it says no health insurance information available. That means the person created the form too early. And the reason being is once that assessment is created, it no longer pulls data from this page. So the only way you can do is to edit it in the form itself. But because they did it early, you can't. So you'd have to discard your assessment and then create a new one. But yep,
Okay.
no, you've got it exactly right, and you're problem solving it exactly right.
Okay, perfect. That's what I was thinking, and I wasn't sure if we should discard or not, so I just had her like finalize it all and then redid a reassessment and just use the same date, and then I pulled in and I was like, okay. I didn't know
Yep.
what discard does, so I was like, oh, not so
No,
sure.
yeah, don't be afraid to use discard in that instance. It sounds, that word sounds a little scary, but I
Yes.
understand. Yep.
Okay, perfect. Thank you.
Yep.
And then I actually have an HRA question. Can I still ask or should I jump off?
You can go ahead and ask because there's just two other people, but
Oh,
I try
perfect.
to make sure people don't ask too many questions, otherwise
I
no one
know.
else,
Yeah,
other
no,
people
for
don't get
sure.
to ask. Yep.
For sure. So my HRA question is, I noticed in the current functionality document there was a workaround, and I just wanted to see if I'm processing this right. So for a non-EW PCA member or a member that gets like just skilled nurse visits, home health aid, just MA services, we are still looking to add those into the support plan under an HRA. And I think I saw the workaround was to type in other because some of those services are not linking into services and supports in the support plan. But then, it doesn't actually calculate, there's no rate to enter. There's no, like, you're putting it all in that comment section. So I guess I just wanted to clarify or make sure that that's the correct way right now. And I guess not knowing if that's going to be a fix or not, or.
So I'm gonna let other folks speak to the rate calculation piece as well as using other.
Well, I don't know about the rate calculation, but you are correct. Currently that is the way you need to, it is, and that, yes, we are actively working on having you be able to actually work with the services. But I don't, as far as the rates, I'm not sure for an HRA why you would need rates for the waiver services because the person isn't on a waiver.
Okay, and that's what I was thinking. I just wanted to make sure that I don't know from,
Yes.
and it might be an individual MCO standpoint that you need a budget or you need a track or something. I'm not sure on that depending on which
Right.
MCO, but I just wanted to make sure. So then, does it matter? Do you necessarily need to add waiver providers in the support plan, or can you just forego that section and just do services and supports since they're not on a waiver? Like, do you need to list out the providers then in the waiver
You
section?
should consult with your MCOs about what they have as far as expectations of
Okay,
what a support plan should include. We are
Yeah.
working on functionality to allow services such as waiver services that are not being paid for by a health plan to be included in a support plan, not necessarily the rates, but the
sure.
services, so it reflects a complete support plan. But
Okay.
once again, you should consult with your specific MCO as to what they expect to be included in the support plan. But
And so
currently,
when you
you
say
would do the
select,
other. Currently, you
okay.
need to use the other as
And
the
that's just, and when you're saying other, I'm just making sure I'm doing that right. It's under the service, you're typing in other, finding it in the notes and
yes,
linking that, correct? Okay.
Yep.
yes.
Okay.
And then we're asking you to add the contact information, add
Right.
the information about the provider in the contact information in
Right.
the text.
Okay.
Mhm. Yep.
Sounds good. Okay. And I was thinking because you selected like the program type as other in the beginning, it's not
Yeah.
EW,
Oh,
that's why the rates aren't showing.
Yep.
no, and that is the other part of it is that what we're working on is that you'll be able to actually choose program type HRA
Oh, sure. Okay.
and things flow from that. But once again, we aren't necessarily building in rates for the waiver services because the MCO isn't covering waiver services in an HRA. If a person is on EW, you
Mm-hmm.
should be using the MnCHOICES
Sure, sure. Mm-hmm.
with staying healthy. Just always
Absolutely.
like to report that because some people are used to thinking, oh, I do an HRA, but you wouldn't do that. You wouldn't
Mm-hmm.
be having services of EW in an HRA. They would
Correct.
be
Yeah,
up
yeah.
in the staying healthy. Mhm.
Mm-hmm. For sure. Okay. Awesome. Thank you so much.
Yeah, and the other piece that I wanted to make sure I added here is the SMART guide for the support plan HRA is in the process of being published. And when it is published, I would refer to it for services that support me services and adding them, because it is going to provide you, once we post it, a list of services that you can go in and search for and add to the person's services that support me, and then you'll only use other for the instances where that service isn't in the list to search from. So
Oh, sure. Okay.
right, so there will be some services available to find.
Okay.
It just won't be a full list, but a really decent list. And
Mhm.
then you'll just use other for when you can't locate one and you need to create a service and say what it is. So
Oh, perfect. Okay. Good. I
okay.
like that workaround. Thank you.
Yep, you're welcome.
All right, thank you, Lena. The next person we're going to go to is Trista. Trista, your line is unmuted.
Have a question about closing support plans. I don't know if you're able to maybe demonstrate or describe just what exactly it means to close a support plan. Like, does that mean the status of the goal is achieved, or like what components exactly indicate that a plan is closed?
Right. So we'll actually are going to cover it in office hours on Friday, but basically it means the status for the support plan is in approved. It'll say approved. Sorry, I'm going to go grab. I'm going to go
Teresa, I
grab
think
it.
it's plan approved.
Yep, I
Status.
think so too. Yep. And so it'll have to be the status will have to be plan approved for it to be considered done.
Well, we put it in that status when we're, unless we're doing it wrong over here, but we move it into plan approved status when we create the support plan and
When
have
you
the
create
goal
this,
started.
yeah, so that's why I'm going to go bring up that I'm going to go bring up a list of statuses for support plans so that we speak about it in the same vein. So just give me a moment. I'm going to actually grab it where I have it easy to find. I'm going to go to the smart guide that we're working on and just bring it over. Got MCO M&A. Part of what so I'm going to show you the draft that we're working on putting into the smart guide in the application. We're adding these support plan statuses so that you know them and you understand when you go through submit what order they go in. When you create a support plan for a MnCHOICES assessment and you're ready to pull the data over, it moves to in progress assessment complete. Then after you hit submit, it'll go to plan pending, then it'll give you the chance to choose request clarification, which would move it back to in progress assessment. But until the plan is in plan approved status, it's not considered done. So
Right. So it's still sort of like pending, or you're working on it, but then once
right.
you've finished all your paperwork and we've done our
Signatures
our
are all
assessment.
done.
Yep, it's done, and then we move it to plan approved. But then a year from now, when we're meeting with them again and needing to open the next year's support plan, what do we do with?
Then but what you'll do is you'll create a support plan, a new support plan, right? You won't revise your old support plan. You'll have a new assessment. You'll create a new support plan. It'll pull data from the new assessment and you'll do it again.
Okay.
Does that make sense?
What
I'm
point
sorry.
then do we? I don't know. I guess like how we do it currently with a CCP is when we consider it closed, we've put like our goal is achieved or it was not achieved and that we've closed it. But like if we just have our support plan that says the goal is in progress and then we create a new support plan for the next year's assessment, what happens with the goals that were in that prior one? Like, do we need to update the first support plan to say that goal was achieved and then we open up a new support plan with new goals?
Yeah, so what you're really
Teresa?
hang on a second, Kathy. So what she's really asking is what data pulls over from last year's support plan to the next year's support plan. So go ahead, Kathy.
Well, I was gonna, so I was thinking that maybe it was, I was gonna talk about revising the support plan. So what Teresa was explaining is, like, you do your support plan, like Teresa said, and then you may have goals that are open, but the person might not meet them for a few months. So you would still go through all the um, status changes that Teresa explained, and they're on the screen to plan approved. But if you have a revision, like if you want to go in later and say that that goal has been met, before, like maybe it's only 3 months from now, you would use the revised functionality of the support plan. I'm not
Okay.
sure.
Update the goals.
That's what I was
Yep.
thinking maybe you were asking, but, and then I can't remember what you said, Teresa. I'm not sure if I can speak to that part.
So yeah, so I'll just try to put both yours and I comments together. So what you heard Kathy saying is if it throughout the year the goals get updated, you can then go in, use revise, update your support plan, and then close it again. And then what I heard you asking is, hey, this plan is closed, the next support plan is available, and maybe some of the goals didn't get done, but I want to talk about how that we are going to take them into this next support plan and we're still going to keep working on them. And so the question that I'm asking, and I believe the answer is that your data will pull over from one year to the next for the support plan. But I'm trying to verify that rather than saying that, yes, that is true. I need to verify it. So I'm asking a couple of support plan folks, and I don't know if the folks here know that answer. So sorry. If you do, please answer that piece too.
Yeah, this is Kathy Vondrum again. So Liz is our support plan person. She's actually on vacation today. I believe you are correct, Teresa, but I also would want to verify that. But I do believe that the information does pull to the new one for the new year. But you're also going to want that new assessment information in there too. So did we answer your question? I know just without Liz here, I'm not exactly, I don't want to say
Yeah,
100%.
I guess like my brain is kind of going, I'm just trying to figure out what our steps in the process are going to be as we move forward with training our teams. And does it make sense then when we say like at the end of the year you would create a revised version of your current support plan and update the statuses of your goals to like achieved, or I guess there isn't a not achieved status. There's just in progress or discontinued. So I don't really know what we use if a person doesn't achieve their goal. But like update the status of their goal to something that is ended and then open up a new support plan that is for their assessment that has just been done, their reassessment.
Yeah, I think that when I think about just it logically, that would make sense. That but I think it also goes, my understanding is every MCO might do it differently. So I would make sure that, each person is consulting with your MCO on what the expectations are about that. But to me, it would make sense that if that is an expectation in your MCO, that there are end dates of when the goals are met, that you would go in and do it before you create a new support plan. You would need to revise your one from this current year before you went in to do an assessment and create a new one. And then in terms of the question,
I was just going to say, I was going to agree. This is Sue Kavenju. I agree with Kathy. And I think what I hear you saying, you're trying to get your thought about practice and what is a person doing and have that match in with functionality. And so I think you're absolutely correct. To me, I would think that a care coordinator is going to go out and do a new assessment. The first thing they would do is review the current support plan with the person and what has been accomplished. What are some things that you're wanting to work on? And then, okay, let's do the assessment. And then, then you create the new one and you bring forward things that maybe still they want to work on. So I think some of that is I think I hear you talking about training. To me, that makes perfect sense. And that you would get the document in MnCHOICES revised up to the point that year's ending, and then you would be beginning the new support plan. And some of those things may in fact carry over. Absolutely. Does that make sense? And now, Kathy, I
Yeah.
think you were going to mention something. Sorry.
Oh, no, that's perfect. I think it was going along exactly with what you
Yeah.
just said, Sue. Yeah, so I don't really have anything to add.
If someone doesn't achieve their goal, do we mark it as discontinued then?
Well, I think that
If they don't
depends
want
on
to
what the
continue it.
goal is. If if it's a goal that the person doesn't want or isn't needed any longer, or it needs to change because it wasn't met, yeah, I guess it's hard to say. It depends on
Mhm.
what the goal is, and maybe it was a goal the person had set and now they don't want that goal or need that goal, but they want a
Mhm.
different goal. I, I don't know. I'm rambling, but I think it really depends on what the goal is, Yeah.
Yeah. Okay. Well, thank you.
Yeah, and Trisha, this is
Oh,
Rakia, and I just want to chime in here and say that if you go out and look at the support plan practice guide, we do have some guidance on what you should enter when it comes to the status of goals. And in there, we do provide guidance on, when you would mark a goal as discontinued. So if you have any other questions related to how you mark your status of your goals, I would recommend that you check out the MnCHOICES support plan practice guide for some additional guidance.
Okay, I'll take a look at it. Thank you.
Yeah, sounds good. Okay, so then our next question comes from Angela Dostal. Your line is unmuted.
Question. I just wanted to comment on somebody else's question about the health insurance information. I've only had this happen once because I don't always pay attention. This particular case, I literally only had a 24-hour turnaround, but I did notice that it did not download until noon the next day, even though I'd put the information in earlier the day before. So I don't know if that happens every time, but I guess just for people to look out for in case they do have that shorter turnaround.
Thank you, Angela.
Yep.
All right, and then the next question comes from Lisa at Tatt County. Your line is unmuted.
I am working on the first HRA while the waiver case manager is also working on their MnCHOICES assessment. So we're both assigned and doing it at the same time. And I went in to create, excuse me, my support plan. And where it says my care team, interdisciplinary care team, it appears to have automatically auto-filled the waiver case manager as the care coordinator. Is that something that is just automatically populated, or is there a way to fix that?
Hi, this is Kathy Vondrum. And actually, Rakia, I mean, you could answer this too. I'm sorry. You can add to whatever I'm going to say. Rakia and I both are working on this. So it does autofill, and we're actually working with our vendor. We're going to be meeting with them tomorrow to understand a little bit more closely how this is functioning. And we are working on hoping to fix this. But in the meantime, you will need to hand correct it. I can't explain why it's happening, and that's why Ricky and I and a group of people are meeting with FEI, our vendor, tomorrow. But it is something that we have noticed and other people have let us know.
Okay, so it is a known issue and being worked on. I couldn't find any information on
Yeah.
the issue.
Yeah.
Okay.
So, and I like to remind people too, for the current functionality document, so when issues are brought to us and we write up that it is an issue that needs to be fixed, there's a process that it goes through that you may have heard us talking about, where it gets prioritized for fixing and things like that. And then we're able to put it in the current functionality document. This is not in the current functionality document yet because it hasn't been through our whole process. So that's why you weren't able to find it, and I apologize for that, but that's just how our process goes with the current functionality document. And the current functionality document is updated and posted once a month.
Okay, okay. And to kind of tag back onto that, at a recent regional meeting for care coordinators, one of the things that came up was, you know, maybe the waiver case manager needs to be listed as or checked as the primary and not as the care coordinator. Does that make a difference? And who should be primary, the care coordinator or the waiver case manager?
My understanding is that primary, that checkbox.
Yes.
I'm not aware that that makes a difference in what you're talking about. Teresa, is that accurate or?
The way I understand primary for functionality is it'll affect when notifications are set up in the system, who gets notified. So if they're the primary, they'll get notified in some instances, and in other instances, everyone will get notified. So primary doesn't affect the functionality as far as who gets printed on a document, as far as we know to date.
Okay.
And that is a very good question, and that's exactly the questions that Ricky and I are going to be meeting with the vendor about tomorrow.
Okay. At this point, is there a standard for who should be considered primary, or can they both be considered primary? Can you only have one?
You mean in terms of the check mark? Or?
Yes.
Yeah, so the primary check mark occurs when you assign the staff to the person. So if you're assigning the staff to the person with a specific role, I would say for each role, right? So like if you assign a care coordinator and then you assign a certified assessor, they could each be primary because it shouldn't be competing primaries. It should
Okay.
be primary
So
specific to that role. Yep.
Perfect.
Mm-hmm.
Okay. Thank you.
Yep.
All right, thank you. Lisa, I'm going to go ahead and lower your hand. And then Teresa, I did want to check. We do have other hands raised that I can continue to unmute, but I don't know if we're moving on to MnCHOICES assessment questions or if we're still in HRA questions, or
we can go ahead and
keeping track of time.
Yeah, we can go ahead and move to MnCHOICES assessment questions as well. So if they still have HRA questions, they could ask them and assessment questions now.
Okay, sounds good. I am going to unmute the line of Allison.
I'm sorry, I thought we had moved on to the MnCHOICES support plan. So I do have a question about the MnCHOICES support plan, if that's all right.
Yeah, you can go ahead and
okay, sorry about that.
Yeah,
I
it's okay.
am wondering if you can just provide some direction for when we're trying to enter a service in the support plan, but the service provider is coming up as not eligible for that particular service. So, you know, we do understand that that's something the provider needs to follow up with DHS on, but I have two questions about it. One is just looking for a suggestion if we're not having success with working with the provider on getting this updated. And then my other question is, are the service providers and specialty codes in MnCHOICES accurate in reflecting, the correct specialty codes for any given service provider?
So you're going to hear a hesitation on our part because you asked two very different questions. I can speak to, in the past, we have had releases as well as the team that does the provider codes has worked with MnCHOICES to make sure the codes are accurate and updated, like they did it systemically because providers were having issues with being able to do it. What to do if a provider is still showing not eligible and you're not having success with that person, I would recommend that you put in a help desk ticket, and specifically you put it, I was going to try to tell you what option to choose so that it could get to the policy person who could look at it, and so that they're aware that it's still occurring. So sorry, I'm just going to bring up the help desk form and see if I can tell you what to choose. Chose policy.
And Teresa, just this is Kathy Bondrum again, and just rest assured that even if for some reason it didn't get the right box didn't get checked, or you don't select the right thing for the rates, policy experts, we do look at them and route them to the right place. So if they get routed to the wrong place for some reason, it would for sure. But there is a rates button there.
Yeah, you could do. Yep.
Okay, we did support, or we did enter a help desk ticket for one of them, which we got a response from DHS on, but we're still kind of spinning our wheels with the provider. So maybe I'll just send that one through again. But then we did come across another one that we haven't submitted yet. So we were just looking for a little direction on that because it does kind of hold up the care coordinator in getting their support plan completed.
Yep, I hear you.
And from what we can tell in the system that we look in, these providers should be able to provide those services. So that's why I was curious as to, how much are these up to date in MnCHOICES, or could there just be some misses? So, but we can submit a help desk ticket for these. Thank you.
I would say that they usually are pretty up to date, but like you said, there might be a miss here or there. And so that's good if you send them in so that we can catch them.
Okay, thank you.
Okay, the next question comes from Sarah Norquist. Your line is unmuted.
Hello?
Yeah, hi Sarah, we can hear you.
I just wanted to make sure you could hear me before I start talking. So I have a question about contacts. It's in, when we're putting contacts in the profile, that list gets really long. I'm wondering if we should be deleting contacts that are no longer relevant, or if we should just be ending the relationship or for the contacts. And then similarly with the health conditions that, if that list is getting really long and they're not relevant, should we be deleting those? Or how do you want us to address those?
So is there practice guidance that speaks to it? Is kind of the first piece. Second piece is the profile is attached to the assessment and the support plan in the way that information is pulled from it. So having it be the profile being as updated as possible will mean that you have correct data because it would reflect real time. Folks, is there anything that you would add to that? I'm trying not to step into policy, but I believe the answer is that you would want them to update the the person record profile so that it does reflect where that person currently is.
Hi, this is Kathy Bondrum again. I would say if, again, going back to, is this something that the MCO has a policy on? That would be my first thing. I can talk about the functionality of the system, but I always want to defer that if there's a policy that your MCO would have about being able to look at history of medical diagnoses or anything like that, we would want to defer to your MCO. But in terms of the functionality, I was just looking at it, and the functionality of the system will allow you to delete a contact. So if somebody, passes away and they're not a contact anymore, you would be able to delete them. Or if they're not really involved with the person anymore, you could delete them. What I need to look at as we're talking is the functionality of diagnoses.
Yeah, one of the things I was looking at, Kathy, is would they add a note to the diagnosis? So I just did this right now, right? Put not actual anymore, just to see what would show up for note. And so you could potentially in diagnosis say, that the person confirmed it isn't or something.
Yeah.
Okay.
And that's a great thing, Teresa. I think that's a great idea, because again, I don't know, it may be important, for example, if somebody had cancer, it might be important to to know that they had cancer in the past, but they've gone through treatment and no longer have cancer. So again, I don't know that we have information out there, guidance out there about that. But in terms of the functionality, Teresa's showing you right now how you can edit it. There is also, in terms of the functionality, the ability to delete them. But we want it to be, what your MCO would tell you to do first.
Sure.
Now,
So the
no.
concern is though we're sharing the case with like CADI case managers and other case managers outside of the
Right.
MCO. So that's where we really could use
Yep.
some more guidance on what would be expected in those areas.
Yep. Yeah, I hear you, because your point being is that it affects other people, it affects other workers, and you want to make sure that you're not causing issues or they're having to think they need to reload information because someone removed it. Yep. Hear you.
Thank you.
Yep.
Okay, the next question comes from Shelley Hines. Your line is unmuted.
Can you hear me now?
Yes, we can hear you.
Anyone hear me?
Hi, good morning, Shelley. We can hear you. Not sure if you can hear us.
Can you hear me now?
Yes, we can hear you.
Oh, good. I'm sorry. I was playing with my different sources to make sure you could hear me. We're coming back to questions regarding HRAs, MCO care plans, and the revision mode. What my staff is telling me is that because they have done some revisions, that very little information comes over from the previous care plan to the new care plan in revision mode. And they can spend upwards of anywhere from, depending on how many updates they need to make, 15 minutes upwards to an hour, hour and a half to carry over all of the services and supports. So it's not all that user friendly. So we just want to make sure. And then our other question regarding that is, do we still need a signature every time we do a revision?
So when you speak to that they need to update the support plan when they choose revised from the ellipsis,
Yeah.
so the services should come over, the rate inputs and dates should come over.
They're telling me that that's not what they're experiencing when they go into revision mode. Some of the things come over, but not everything.
So Teresa, this is Kathy Vondrum again. So we recently, and I don't remember the date of the release, but there was recently a release done regarding this. And so has this been recently that they're telling you that this is not coming over, or was it a little, a few weeks ago? Do you have any sense of that?
The person I have sitting here, didn't you just open one to do?
That was a new one. But the revised one was a.
Okay, so the last one was a little bit ago, so
Yep.
that probably explains with the new release.
Yep, correct.
And I think I'm just gonna tandem Teresa on what Ricky was asking earlier regarding with the managed care, what we like to do is we want to say that the goals have been met or that we're carrying them over, but again, it creates a whole lot of extra work for that care coordinator to go in and do revision on the old one to update the status of all those goals. And then go and do a new one with their annual HRA and HRA support plan. So I'm hoping maybe we can work with that with, the managed care health plans can all get together on the same page and give us the same advice regarding how to proceed with that, because that's a huge mountainous task to go into a revision mode on an old support plan from last year's assessment to update it and then go and do a brand new one. Does that make sense what I'm saying? It's just for workflow, it's a lot. It's a big lift and ask of the staff to do all of that. When they're also, in our case, also, if they're on waiver, they're the waiver worker and they're the care coordinator. So they are doing double, double, double.
Yeah, we'll take that concern back. I have marked it in my notes.
Thank you so much. We appreciate it.
Yep.
That's all we have, I think. Oh, the signature. You guys didn't answer that. Do we need a signature with revisions on care plans?
Yeah, hi, this is Rakia. I think when you go to revise a support plan, and I don't know, Teresa, if we have one that we can look at, maybe this is where you can maybe pull up Charles. Because I believe when you go to revise a support plan, there's a question in there that asks you if you need new signatures. And then if you select yes, then you will be required to obtain those signatures. But if you select no, then I believe the signatures would copy from the previous plan.
Yeah, and the piece,
So we can
Ricky,
look at that.
The reason why I hadn't answered anything on it is because what I wasn't sure about is if we're talking policy about when signatures are required.
Right, that's what we wanted to confirm.
Right, that's what I heard you say too. So when are they required? So if it's a support plan for a MnCHOICES assessment MCO and service, something about the service changes, I'm assuming the answer is signatures are required. If it's an update to a goal, that it might not be. And so, like I said, I know that I'm not policy, I'm only functionality. So, but I heard that being the question that was being asked.
Yeah, and then in that instance, then I would also refer back to the support plan practice guide, because we do have a note in there or some guidance that we say, when determining if the plan needs new signatures, and then we do speak to significant changes. So if you want to look at the support plan practice guide for just some guidance on if new signatures would be needed based on what changes you're making in the support plan, then you can look at the support plan guidance documents for some additional guidance as well.
Okay, thank you. That's it now.
Okay, so then the next question comes from Heather Robinson. Your line is unmuted.
Okay. Hello?
We can hear you, Heather. Go ahead.
Okay. So I just ran into this yesterday. There was a member who had a MnCHOICES assessment done in January, and then they switched their health plans. They didn't switch their health, they're now MCHO. So I'm trying to do a THRA, but it doesn't pull any of the information over. Do you have any ideas on what we're supposed to do with that for the THRA then?
Did you say they're on EW?
Nope.
Okay.
They're
I
not on
guess
EW. They had a MnCHOICES assessment done just for PCA services, but they're
Oh,
not on
but
a
they're on
waiver at all.
PCA. Okay.
Yep.
You would need to do it. You can't do an HRA. You need to do the staying healthy section up in the MnCHOICES.
Yeah. But
Right.
they had like a transitional HRA that needs to be done.
No, you would be doing
No. Okay.
MnCHOICES with staying healthy to get the HRA. We're working on some guidance about these transitions. And I know one of the
Okay.
question we had was with the PCA. I don't know if we've fully consulted with the PCA staff how to do that, but the THRA only works if you're going from like an HRA to an HRA.
Yep.
Right. So you're trying to get an HRA in for somebody who's on PCA. Is that the question?
We have to do a transitional HRA. So like in our system now, it doesn't matter.
Well, remember there isn't such thing
Yeah.
for someone on
Yep.
PCA. It's the staying healthy section, which
Sure.
is your HRA.
Okay.
So you're trying
So
to
in the
yeah, because this person doesn't have an HRA, I'm assuming.
Yeah. Yep. Nope, they
Yeah.
don't. So do we
Yeah.
need to just continue to use like the health plan documents then probably?
Well, in the meantime, you might have to because we're working
Okay.
on getting for a timeliness. Team on here, I think we're working on some guidance on this. It's the whole
Okay.
issue of how to get people into MnCHOICES. There's a whole bunch of different scenarios. So
Okay.
watch for some guidance on that.
Okay, that's fine. Thank you so much.
But thank you for the question. It is a legitimate question.
Yeah.
Okay. The next person I am going to unmute is Sarah Miller. Your line is unmuted.
Quick question for you guys. We have a member who was assessed by a county assessor, and they are not open to a waiver because our favorite U code. They have now enrolled into managed care as a 2-1. So we have to get the service plan done. And the assessor obviously does not do the service plan because in the fee for service world, they would be assigned once the U code is removed. So 2 questions with that. One is, the care coordinator is a little concerned about ending the assessor and assigning herself. Is that going to affect anything, or should the care coordinator go ahead and make themselves the assessor now and everything so they can complete the service plan? And then based on what I was just hearing is because this member has never had a HRA, now they need to do an HRA 2 and not a THRA?
So can I ask a question? Did you say that they are on waivered services or not on waivered services yet?
They are not on waiver services yet, but they are going to open as soon as the U code is removed. But
thanks. That just helps with potential answer. So
no, thank you for clarifying. I appreciate that.
So I know policy are speaking with each other, so we're just going to give them a moment.
I thought it was an easy question. So.
Well, I think it's probably who's speaking to it and
fair enough,
right?
So what kind of an assessment was done?
So it was a full-blown MnCHOICE assessment done by a county assessor.
Because, by a county.
Yeah. And
but the person is on for what's
so that was before they enrolled into a managed care. So I'm guessing Right.
Okay, is it a
So-
person over or under 65?
Well, now they are. So either at that time they were under at that time they hadn't enrolled into managed care. I'm guessing it's just a timing issue. So as of 2/1, they enrolled with us, but the assessment was done by a county assessor in January.
But are they on MCHO or MSC Plus, or are they
You
on
know, I'm going to be
SMBC?
honest that I'm asking for one of my delegates and I did not get that information.
Okay.
But the goal is for them to open to the elderly waiver when the U code is removed.
Okay, so
Question
they're
is
over
now-
65, so they're on
right,
MCHO or
yeah.
MSC Plus.
They're on one of those. The question is,
Right.
how do they, like, the care coordinator wants to go do the service plan to be in compliance. They're just concerned on how they assign themselves. Now, additionally, too, they were going to go do the service plan, and normally they would have to do a THRA. But what I'm just hearing now is actually they have to do an HRA because no HRA has ever been done.
Right. So what? So
Well,
you are at.
yeah, they shouldn't do the HRA. They need to do the staying healthy section in the MnCHOICES assessment because the
Correct.
person is going to be on a waiver. Because if you do an HRA, you're going to end up with 2 support plans, which you
Right.
don't
So
want to
do a
have.
THRA. Got it.
No, you don't do a THRA. You
Just finish
do
the
a
service.
MnCHOICES with the staying healthy. And this is another one of the scenarios that we're talking about.
Okay.
And I I wait for guidance, but I think, Kathy, is this the one where we're talking about them being able to do a functional needs update? I think.
Yeah, that is that was something that we talked about.
Okay.
Right.
So I just wanted to make sure that people are understanding when you're saying, Sue, to do MnCHOICES assessment with staying healthy. Is everybody understanding how to do that?
Well, and that's what I want to clarify. I'm trying to do some retraining here. Is that if somebody is on EW or PCA and is on MCHO or MSC Plus, you need to do the work, including any other HRA type work in that MnCHOICES with the staying healthy section. The staying healthy section is the HRA for that person. That if you do an HRA for somebody who is on EW, going to be on EW, or is receiving PCA under MCHO or MSC Plus, you're going to end up with 2 support plans. And what we've designed is the MnCHOICES with the staying healthy section is to be kind of integrated to allow you to just have 1 support plan with things of the HRA components plus the waiver and PCA together. So that's what, when I talk about what we're talking about, and part of the questions that we keep getting is how do we get people into that kind of workflow into MnCHOICES so that we're not ending up with 2 support plans. And so what we're getting here are a lot of your different scenarios that people are asking us. And so that's what we're trying to help and give some guidance on so that you're not, people keep talking about a THRA. Well, that only works if there's an HRA already in MnCHOICES and you're just wanting to do another HRA. That's kind of in that HRA workflow. Whereas we're talking about somebody who's on a waiver or PCA who's in that kind of MnCHOICES with the staying healthy section, which is, remember, the HRA component for somebody on those services. So that's when we're talking about those different things.
Okay.
Right.
So back to the original ask, and it came a 2-part question. So my care coordinator needs to get the service plan done because one hasn't been completed, and we need to be in that 30-day timeline. Should she go make herself now the assessor care coordinator? Is that going to affect anything based on that known issue, or it shouldn't be a
Is
problem?
this person now on your plan?
Yes.
Then I think she can, correct, Teresa?
Yeah,
Yeah,
that's
just
where I
wanna
was
make sure her
going.
functionality, that's fine.
Yep.
Okay.
Yeah, as long as the handoff was made and it's clear and everybody knows what's going on, you can basically unassign the current certified assessor, add your staff as a certified assessor and care coordinator, make sure all the assignments are where they're supposed to be. If you leave the location for that agency on, it won't affect it negatively, but at some point you'll want to take it off too. So that it shows correctly for the person. So you could unassign the staff, assign your staff, unassign the locations, assign the new location, as long as the handoffs are complete.
So what a recap of what I'm hearing, should be no problem assigning herself. Eventually they're wanting to go to location and end the county and make sure it's just showing as an MCO.
Yep, because you can have both locations assigned and then have the staff assigned for each. But you're going to want to clean it up. Otherwise, it's always going to show up on that other agency's books. So.
Yeah, and who likes clutter? So it
right,
sounds good.
exactly. Clean it up at the same time.
All right, thank you for your help. Appreciate it.
Yep.
Okay, we're going to move on to Emily Gerard. Your line is unmuted.
Quick question about functionality and roles. Is it intentional that people with different roles can make changes to plans that don't necessarily match their roles? So for example, a waiver case manager being able to make changes to an HRA support plan, a care coordinator being able to make plans to a waiver support plan. Is that intentional, or is that not working as intended right now?
So if a staff member has a case manager role in their location, right?
Mm-hmm.
Then they can make changes to support plans, regardless of the support plan type.
Okay.
Yep. The roles are not that. What would you say? They're not that. They're not that far drilled down.
Okay. So we've just run into situations both where my staff have made an error and not paid attention to which support plan they're touching, and also the other direction where somebody on the other side has like gone in and discarded our current support plan. Thought that it was, and it wasn't. It was ours. So just okay.
Yep, I hear you. Yep. Yep.
And once a plan is discarded, there's no way for DHS to reopen that. Is that correct? Our only option is to revise? Or can we not even revise a discarded plan?
Or do you create a new plan and it copies over from the discarded plan? Is what I think the answer is.
Oh, so rather than going through the revised feature, we would create a whole new one and it would still pull? For some reason, I was thinking the only way it would pull was through revise, but I guess at annual it would pull from the last one too.
Yep.
Okay.
Yep.
I'm not sure that you would be able to revise.
I don't think.
Yeah,
I don't think.
Plan.
Revise probably wouldn't work on a discarded one, right? Because it has to be in plan approved. Okay. Okay, we'll go ahead and create a new one and hope that most of it pulls over.
With the most recent release where the data copies over, the services copy over, the dates copy over, the inputs copy over, you should see an improvement.
Yeah. Okay. I guess maybe just a suggestion would be at some point with training announcements or with these webinars, if maybe that reminder could go out to everybody.
To be careful?
To just be really careful. Yeah, which I know seems like it should be second nature, but as we're all, the concept of case managers and care coordinators being able to see other people's work in a system is so new that we're all, I think staff are just all a little bit overwhelmed and they're not used to being able to have quite so much access, which is a lovely thing and leads to lots of human error, understandably. And like I said, my staff have done it too by accident, and they're like, this plan isn't working the way it should be. And I'm like, yep, it's not yours. Back out, please. It's not your plan. But yeah, I think just a general reminder that people have maybe more access than they think and more power than they think. I think that would be helpful.
Thank you.
It's good to know that it is. I understand why they can't be filtered down so far. There's only so far we can go, but I'll remind my staff to be extra cautious. Thanks.
Yep.
Okay, the next question comes from Ruth. Your line is unmuted.
Okay, I have a couple questions, or maybe clarifications. One question is, can you have two support plans open at the same time? And the reason I ask is, as we've been talking about with the MCOs, we're supposed to go in, we're supposed to close the goals or whatever at the end of the waiver span or sometimes during the waiver span. But if we're doing that, and then we're also prepping the new support plan for the new waiver span, can both of those be opened? We have been told that no. If you open a new support plan, it's going to close any other support plans you have open, which is going to totally defeat our purpose. So that's the first one.
So functionality standpoint, the system doesn't close plans, one or the other, if the other is open. It may give you an edit that tells you, no, you can't have a support plan of that same type open because you have another one open. But it won't. I am not aware that it will auto close a plan.
Yep, Chris, I think you're right. It won't auto close. You'll probably get an error message that says you already have a plan open. So the system won't allow you to have two support plans of the same support plan type open at the same time.
So we really,
it would be
I guess
sequencing.
that presents the problem of how do we go in to address this waiver span's goals, whether they're met, discontinued, going to be carried forward, which I would just then say they're still in progress, and and start on the new support plan when we're going to do that on the same face-to-face assessment review support plan visit with the person.
Yep.
So that is going to cause problems. So
yep, I made a note of it. We'll have to go back and talk about it because
you know, so that for I mean, I think the big difference is the MCO requirements. Unfortunately, a lot of them are not built into the MnCHOICES revision. And so that's causing us as MCO, case manager, care coordinators, difficulties that don't come up with somebody that is fee for service. But I think that needs to be addressed because I think you've heard quite a few things coming up about the support plan and how do you do both, and being able to do a revision and so I mean, I guess part of that question would be, can you have a revision support plan and a new support plan open at the same time? Because that's what it would come down to.
Yep, I hear you. We'll take it back and look at it. We kind of gave you what we thought our first responses for functionality. If I'm hearing you say that is the need, makes sense based on face-to-face, then it needs we need to have discussion and come back. I don't want to have us answer too early and be incorrect.
If I'm going out to do especially a reassessment with an MCO member, I'm going to do my assessment. I'm going to go over the previous support plan because I have to address those goals. I'm going to address the new support plan going forward. And I'm going to do that all in one visit because all of that is my duty. Why am I'm not going to take the time to do several visits so I can do each step.
Yep, I totally get it.
The other, I guess, kind of clarification is in relation to a MnCHOICES being done by a county assessor. So the person theoretically is opening to fee for service to start, but then they go on to the managed care plan as that's all kind of in. So you're saying, I mean, wouldn't it, as far as support plans needed, wouldn't it depend on when the elderly waiver services would start? I mean, I guess my thought is you would need a support plan for the fee for service period, and then you would need a support plan, maybe updated, but a support plan for when they go on the MCO. Am I thinking that
Yeah,
wrong and giving
no,
myself
this
too
is
much
Sue.
work?
This is correct. You're correct. And that's what we're trying to help with some of these transition issues so that you can continue on with a support plan that meets the needs of now that the person's on managed care. Correct.
Mhm. Or does it matter if so the person is assessed by the county assessor, but it may be, I'll just say in January or yeah, okay, in January. Maybe EW isn't going to open until March. So then would you need a support plan for assessment time? Would you need any support plan prior to them being on MCO or just when they open to EW, okay, now they're on MCO. So you would do the MCO support plan?
So
And
I'm
then,
assuming that's what you were speaking to when you were saying you're going to provide guidance on that and that
Right.
workflow.
Right.
so
And
I
some
guess,
of that has to do, but some of it is just outside of MnCHOICES either.
mhm,
You know, to me, I can't speak to what fee for service policy is as to whether a support plan is required if the person isn't, at what point is a support plan required?
right. I
You
mean, because
know,
I guess my understanding would,
And then in that
yeah,
instance, I guess I would add, if that's what you're asking, I think you should go put in a help desk ticket and
right,
ask for clarification on that,
okay.
because to me it's a deeper policy question than we have time for
right.
today, but I think
Mhm.
it's a question that you definitely can ask. And so that's what I would recommend that you do is ask the question using a help desk ticket.
So, and kind of along that question too, because, okay, so
And
they were,
Ruth, just so you
yeah,
know, I just want to make sure that I'll let you ask one more and then we need to move on
okay,
because I know we have
okay,
other people asking questions.
no, that's fine. So are you saying that then instead of doing like the MnCHOICES HRA because they went on, that you would just go in and would you pull a new assessment form so that you can get the health questions?
That is the guidance that we're working on, whether we're
Okay.
going to have you do a functional needs or exactly what. But if there is a MnCHOICES assessment completed that shows the person eligible for EW or PCA, and now they're moving to managed care. And you don't need to do a full MnCHOICES assessment because that's been done, but you need to do an HRA, which is for a person on EW or managed care, the staying healthy section. We're
Right.
giving guidance on how for you to do just that component
Okay.
by
All right.
pulling over the assessment information that was done when the person was not on managed care into that one assessment. So one support plan gets created for you. Correct.
Okay. Okay. Thank you.
Okay, the next question comes from Carly. Your line is unmuted.
Hello?
Hi, Carly, we can hear you.
Oh, perfect. Thank you. And I apologize. I had to join a few minutes late. So if this question has been asked and answered, just stop me and I can review it in the recording. We have a question about duplicate charts. So we've had a few instances come up where we've noticed that care coordinators have done full HRAs and support plans in a chart that they created that is now a duplicate. My understanding now is there is no way, you guys don't have a way to merge right now. So what would be your recommendation with the current work that they have in a chart that's wrong?
What I hear you saying is that there's 2-person records and they've completed a form in 1-person record and they should have done it in the other.
That is correct. Yep.
And the reason why you know that is because the other record has other information in it. Does it have other forms in it too? That's one of the things I'm wondering
Yeah,
about.
I'm not quite sure if how
Mm-hmm.
they found that there was a duplicate. We do have some training coming forward on making sure care coordinators understand to do the import and not create
Right.
new
Yep.
charts. So
Right.
we will try to prevent this from happening in the future, but just wondering what we should do, especially if these support plans and HRAs are already completed.
Right.
You know, they're not still open or anything.
Right, because you're concerned, because I was just thinking about the timing of it all, right? So we started launch in July. Is it likely that there'll be forms in two places? If there is, then the question is, how do you point to the other record? Because the form isn't a document that you could attach, question mark. And so I'd be interested in what policy thinks about that. It might be something that you could put in and ask in a help desk ticket so that we could formulate a response that it would be, you know, kind of take everything into account. I have some ideas, but my ideas aren't the final, of course. So
Yeah, we just, you know, we obviously, you know, we had thought, well, can we maybe download them and put them as an attachment in the right chart? But then we don't
I
know
know I
how that
was
works with tracking, you know, so it's
right.
like we
Yep.
don't want
Nope.
to kind of redo
I
the
was
work.
Yeah, I was thinking the same thing, and that's why I'm like, you know what, put it in as a, if you have an instance where a person record has forms done in two different person records, yeah, put that one in because we should have a conversation about that, and having an example of it would be quite useful for us.
Okay,
Okay?
great.
Yep.
Yeah,
So
and then
give us
if I could
so
just,
give us the person IDs for both of them. Say, hey, yep, there's forms in both of them. You know, what do you want us to do? That would be useful.
great. And I know everybody else has questions, so I just have one more quick one. We've noticed in a couple instances where a member may have, you know, a care coordinator, which is us through the MCO, and then also a waiver case manager, we're SMBC. So, and the waiver case manager has started a form by accident. So like started an HRA support plan, for example, and then instead of discarding it, has let it just sit in there. So then we're unable to open one correctly. Obviously, the first plan of action should be to try to reach that case manager to ask them to discard it. However, if that can't be done, is there any ramifications that could be caused if we just went and discarded something we can clearly see was created by accident?
So, I mean, I think the first piece is how would you make contact with that person? So you could do messaging inside the system, but you could also search for that staff person up in the search if that search option was available to you, and you could email or call them as well. And at least if you emailed them directly to their agency email, you would have a record too that you've notified them.
Okay. And then if for some reason they're not responding or we can't get it resolved, is it
The
okay
other
to discard a document that we didn't create?
I think that that's always a tricky one, right? So you hear
I
me
know.
hesitating. The only reason why you hear me hesitating is then if you find out later, oh, yep, they actually needed that for some reason. You've discarded their work, which is the whole be careful message you heard earlier.
Yes.
Um,
Yep.
the other option most staff members also have a supervisor listed. And if you would just wanted to email that supervisor and say, hey, tried to contact this person a couple times. We see that they created a support plan form, inadvertently. We want to go ahead and discard it, just out of courtesy, we're letting you know, or something like that. I would think, but again, I want policy to weigh in on that because I'm only speaking from a functionality aspect of what's possible. And so, would you guys add anything else to that? I want to be careful.
Hi, this is Kathy Bondrum. I agree with you, Teresa. I think I was hesitant to say anything either because of what the previous person had said too about people deleting things or discarding things that shouldn't have been discarded. But on the other hand, I also understand if there's something just hanging out there and then it's keeping you from doing your work. But I like the solution that you had, Teresa.
I appreciate those same things came to my head when I was asked this question. So just wanted to see if there was anything additional. So that was it for me. Thank you.
Thank you, Carly. Okay, so the next question comes from Sarah Miller. Your line is unmuted.
Oh, sorry if I still have my hand up. I apologize.
Oh, no worries. Okay, the next question comes from Susie. Your line is unmuted.
That she did the MnCHOICES full assessment, and it ended up showing that it was a case mix A, but the person didn't have any dependencies. But she completed the assessment, all, you know, it was all fine. She did the LTC screening doc, and then when she went to enter it into MMIS wouldn't accept it because they would only accept it as a case mix L, not an A. So what should we do about that?
This is Kathy Vondrum again. I would need you to submit this as a ticket so that I can look at it more carefully.
Okay.
Closely. And if you can put the person's ID number that you're talking about, then I'm actually able to go into the record and review it.
Sounds good. Thank you.
The one thing I just want to say, I always start with asking people to make sure that they've, you know, when they click get results and then they click save and then they go to the screening doc and they have to save the screening doc, just to make sure that everything is, the results are calculated and everything. So that will be the first thing, just to make sure that your staff did that.
Yeah, so to just maybe talk about that a little more. So if for any reason, if they made changes to the assessment and did use the get results button, but didn't go back into the screening document and choose save, it wouldn't update the screening document. So when they went to enter it, they may have incorrect data, but it sounds like the issue is more about they got case mix A and and MMIS is expecting case mix L. So help desk form is probably the best solution for that specific item. But Kathy will ask the other question. We are ready for next questions, and because we're at 11 o'clock, I think support plans and all other questions can be asked at the same time. I don't think we need to, people have to worry about what question they're asking, Rakia, so go for it.
Okay, the next question comes from Sarah Tellerjohn. Your line is unmuted.
Just have kind of a request and wondering if possibly after these calls, you might be able to type up a Q&A document just on some of the common themes. Most of us mentors try to make the calls, but it would be helpful to just have a guide of what was covered. Just the updates are really, really helpful. And then also, like you mentioned, the in messaging inside the system. If at any point, you know, when we start talking about more transferring and communication between agencies, when everybody's all in, any type of guide as to, you know, some communication protocols to follow, and, you know, kind of, I guess, maybe courtesy practices when you're transferring someone in MnCHOICES. The person who said, you know, we're all working in the system, we're all new, and you know, there's human error. Just having as much guidance as possible would really be helpful. And then also appreciate the forthcoming guidance on the county transfers. We're really seeing that we do see a lot of people with their 65th birthday assessment. They get right onto managed care before they can get a support plan started, or even before their services are started. So we did get that guidance on moving over the assessment from the previous assessor, doing the staying healthy and creating a support plan. So that was very helpful. So just looking forward to that guidance. So that's it. Thank you.
Yep, and I think part of it for us, just so we're clear, is the reason why we don't create a Q&A document is because it's very hard on our side to keep it up. And much of the answers that we're giving you are available in training or in smart guides, which is why we try to refer you there. Which is why then we'd have the recordings, is because that's really the only way we can do it and stay timely, as well as office hour slides or other things where there is content we have it available there as well. But I took your suggestion for communication protocols and courtesy practices into account, and it is in the DHS 6037. There are instructions for transfers and moving documents back and forth.
Thank you.
Mm-hmm.
Okay, the next question comes from Jessica. Sorry, Jessica, your line is unmuted.
Additional guidance is coming, but I just had a quick question. So with the scenario of not completing an HRA when a person is open to EW or PCA, and we're supposed to complete the staying healthy section in the MnCHOICES assessment, what if the person or the care coordinator is not a certified assessor? Would they still be able to create that and complete that section?
Is this a person on MCHO or MSC Plus?
Well, I'm talking about like for PCA. So our SMBC
Well,
care
but it's
coordinator.
oh, you're talking about SMBC. What we
Yes.
talked about is the staying healthy is only for people who are on EW.
Oh,
The
okay.
staying healthy. So if you're talking about somebody on SMBC, you would be doing an HRA.
We would. Okay. All right. I just
Yes.
wanted to clarify. Thank you
No,
very
that's
much.
always good to clarify because the MnCHOICES is for for people on MCHO and MSC Plus who are receiving long-term care services, EW or PCA. For SMBC, the health plans are just doing HRAs.
Okay. All right. Perfect. Thank you.
Thanks for asking so we can clarify.
Okay, the next question comes from Sophia. Your line is unmuted.
Questions. One's kind of a follow-up. When we have a support plan that we do plan approved, and then they go back in and do their quarterly calls and they revise the care plan to put in their new update, do they have to have that go back to a plan approved status, or is there a different status once you revise a care plan or support plan?
So your question is really about, do goal statuses have to change back, or can they be retained or moved to a complete status in revision? Is that what I hear you asking?
No, so we're an MCO for SMBC. So we'll do the initial support plan, and then 3 months later we do our quarterly check-in with the member. And if there's any updates that we have to do to the care plan or the support plan, we'll go in and say, we did our first quarterly attempt, talk to the member, everything is okay. No goals have been obtained yet. And then we go back, how do we mark the status? Does that status need for the support plan have to go back to plan approved? Or does it stay where it says plan approved? Or in progress, or does it go back to in progress assessment complete?
No, so if you're done with it, it needs to go back to plan approved. So if your
So
plan approved says it's done.
Okay, even when we do a quarterly check-in.
Yep.
Okay, and then my other question is, when we're doing our initial support plan, one of my nurses had mentioned that they had to add in a caddy manager onto the support plan. We didn't assign them as a staff assignment. It was just on her support plan. And she received a call from the caddy person that she had listed, saying that she was no longer the caddy manager for that member. And then we have difficulties finding out who the new caddy manager is because they change so often. Is there any guidance that we could get for that?
About who to know is the caddy manager?
Yeah, because the member will tell us this is their caddy manager. They have all the information, so we add it onto the support plan. And this certain care coordinator received a call. I don't know if the caddy manager, if something popped up, but she called and was in contact with the care coordinator and said, I'm no longer that caddy manager. I don't know who is. She tried to call the front door and just kind of you know, tried to reach out to who they said was a new caddy manager, never got a response. So we're not sure what we should be doing in that situation, leaving who the member says is their caddy manager, or we're not quite sure how to do that.
So you're asking specifically from a documentation standpoint, and I don't know, folks, are you thinking that the MCO needs to give direction on that? And then in regards to, is there a way to help them out on our side to know who to reach out to? Potentially look at the last case manager supervisor and ask that question might be a possibility in the system. But again, I don't know that we have guidance on that any guidance on that might come from the MCO, but I can't speak to that. That's just my thought off the top of my head. So please verify or say, nope, Teresa's totally wrong, so that we can answer the question. And I'm giving you a chance to talk to each other. So sorry if I sound rambly from the audience's end. I'm just giving policy a chance to talk.
Yeah, and a lot, sometimes the caddy managers aren't assigned under either a location assignment or staff assignments.
Yep, I hear you. So there is nobody to go back and look for. Yep. So to me, it feels like this is policy guidance from potentially from the MCO on what to do for follow-up. So thoughts, folks?
Well, this is Sue. I don't know if this is truly a MnCHOICES question. I know you're asking to make sure it's correct in MnCHOICES, but you know, this even outside of MnCHOICES, wanting to know who you're supposed to be communicating with regarding caddy and the member. I think you mentioned the fact that the member gave you information, but I didn't catch, where did you get the information that that person is not the caddy case manager? Did you get it from that person? And were
Well,
they not able to tell you who took over for that member?
What was brought forward to me from the care coordinator is the person that she had listed on the support plan was in contact with her and said she was no longer the caddy manager and didn't know who was.
Oh, and
So,
didn't know who was. I'm sorry, I
Yep.
missed.
Yep.
I missed that.
And so we tried to call the front
right.
desk, and then, you know, we kind of, sometimes we get the runaround because they change so often
Right.
that it's hard.
And I guess,
and we're
that's where
supposed
I was
to,
going. I think that, you know, as I said, I know you want MnCHOICES to be accurate, but you know, the bigger question is, who are you supposed to be working with regarding this member, which is the
Yeah.
bigger question. And
because that is a requirement of our MCO is to, you know, make sure we're sharing that information, and it's kind of hard when.
Right. I think it, yeah.
And Sue, that's
yeah.
why I answered, you know, maybe that's MCO policy, right?
That's why I said I think you need to
go back to the MCO.
Go back to the MCO, correct, about especially because it's their expectation. I think we've talked about, some people talked about you contact the agency. Somebody talked about looking up in MMIS as to who the caddy case manager is listed, but in some cases that might be still the person that who did, you know, that originally was, but you could look there to see if that has been updated. But I
Okay,
would
thank
go
you.
back and ask the MCOs for guidance as well.
Thank you very much.
It's a good question though, and I do appreciate, because it is important information to have accurate information. So thank you for asking that question.
Okay, the next question. Oh, sorry. Sarah, do you still have a question? Sarah Tellyjohn, I see your hand is raised.
Oh, sorry about that. No, I do not.
Okay, how about Angelina? I see you're next. I'll unmute your line.
I just had a question for support plans, program types. If we're completing a full MnCHOICES assessment, but for whatever reason they don't qualify or they don't want elderly waiver, what program type should we be using for the support plan? Because my understanding is we shouldn't select other because that's for HRAs only.
Are you in MnCHOICES, the MnCHOICES assessment, not the HRA?
Yes, yep.
Yeah.
They completed a full MnCHOICES MCO assessment, but for whatever reason they don't qualify for elderly waiver, or they just choose not to go on elderly waiver.
Are they on any waiver? Are they choosing any waiver at all, or
no,
doing non-waivered services?
Yeah, this is kind of just a general question because this has come up for some of our care coordinators. Like they'll offer assessments and the member may want to choose to see if they qualify for elderly waiver to maybe get homemaking or something, but then end up not qualifying or they just choose not to go on elderly waiver for whatever reason. So just wondering what we should select for the program type.
So are you saying they're not getting any services, or they are going to get services? It's just not elderly waiver or waiver program?
It may depend on the situation. So in some cases, yeah, maybe they'll just choose to just get PCA or maybe like skilled nurse visits or MA services, and some they might just choose to utilize informal supports.
Your question again was about program type, right?
Mm-hmm. Yep.
Yeah, and I'm wondering, Teresa,
Yep.
if you can go pull the system back up. I'm just wondering exactly where in the system you're selecting. So if you have go to create a new support plan. I don't know if you have any
I'll
support,
try to pick
try
somebody.
to create a new plan and see how far we get.
Yeah, I got to see if I have a support plan, a person I can use, and if we have a support plan created, it probably won't get us all the way to program. That's what I was
It's in the
thinking
beginning
through.
of it.
Yep.
So.
Yeah.
So we'll just do this. Whoops, sorry. We'll go back. Okay.
So from here,
So
you're
choose
selecting
support plan
and then support plan. It's
then
this
right
program
here.
field.
Yes.
And you're saying you wouldn't choose other because other is when you are creating your HRA support plan.
Yeah,
right?
that was my understanding from you guys is like normally I would, I think instinctually choose other because they're not on any of the other programs.
Right.
So, I think a lot of our care coordinators would just choose that one because that's the one that fits the most. But I'm just wondering if that's correct or not.
Yeah, and then potentially in services and supports, pick people that support me so they could put their informal caregiving, right? Or informal supports is what I hear you saying.
Yeah, I'm
But
thinking you would
that
choose
other
other
is for
because in
HRA.
essence, you are just doing an HRA at this point then. You have this, you did the staying healthy and you're needing to do a support plan that shows the non-waiver services. And you would, a screening document will be created showing the person not eligible or not wanting services that you can and should be putting in MMIS showing that the screen was done, but the person is not going on to services.
Correct. Yep.
Right?
Yes.
So it sounds like your inclinations are being confirmed as the correct path.
Okay, thank you very much. That's all I had.
Teresa, I'm wondering if have you sent that ticket in? I'm sorry, I can't remember who was just talking.
That was Angela Cassetta.
Angela, have you sent that in as a ticket?
She's on mute. So Angela, if you would like to, you feel free to send that in as a ticket and pick policy managed care. and then it sounds like Kathy would like to have them have a discussion about it.
Okay,
Yeah,
I
I
haven't
think
put in a specific ticket on that. I know that I've put in like tickets because some weird stuff have popped up when we selected other and completed a full MnCHOICES, and we've gotten I've gotten a response back from DHS reasoning why, but
right.
no, not
I
specifically
think
for
I
the.
might. I actually think I might have responded to one of those. My
Yes.
concern is that if you've done a MnCHOICES assessment and you click other for support plan, the system is expecting it to be
HRA.
an HRA has been done, a health
Oh.
risk assessment has been done on the person. So my concern is that the information from your MnCHOICES assessment will not pull into your support plan. And in addition to that, you might see weird errors like if it is the one that I responded to that you'll
Yeah,
see.
it was
So
like I think like a DD CFSS like pop-up was showing up for some reason, and
yeah,
just
so I think the best thing is if you still have the question to submit it, because I'm concerned about you doing other in that situation.
From a functionality standpoint. Yep.
okay. I'll put in a ticket because I'm sure this will be kind of a common well, I don't want to say common, but
it may
come up
occur
a few times. Yes.
Yeah.
Yep. Okay, thank you.
Thank you, Kathy, for catching that piece.
All right, Teresa, the next question comes from Sheila. Your line is unmuted.
Go back to the person who talked about the case mix issue. We came across the same thing yesterday as well with the MnCHOICES screening document saying they are case mix A and MMIS only allowing NL. So I think it is a big issue. We sent in yesterday as well. So just want to confirm that there's some kind of glitch.
And so, question for you is what program are you using when that occurs? So like, is it a waiver or is it?
Yeah, elderly waiver.
Thank you. It's
Yep.
just good to have that piece of information.
Sure.
The reason why I was asking the question is to make sure it isn't in current functionality document. And so I just I needed a little more information.
Mm-hmm.
Hi, this is Kathy. And when in that situation, did the assessor have some sort of an idea what they thought that the case mix would end up being?
It was a reassessment.
Okay. And
so yeah, they kind of knew based on the dependencies that it wouldn't necessarily be an A.
Okay.
Yeah.
And MMIS was confirming that because there was an error.
Correct. Yeah.
Okay. Yeah, and if you have sent it in, it will come to me and I'll be looking at it. So thank you for sending that in.
Mm-hmm.
Okay, Teresa, we have one more person with their hand raised, and it's Allison. Allison, I'll unmute your line.
Hi, I was wondering if we could just go back to when you talked about being able to locate a staff member and their supervisor in MnCHOICES. So I understand how to find a staff member, but I'm not seeing where we can go and find that supervisor if we're not getting a response from the staff person. Are you able to share where we would find that?
So first of all, I'm going to try it as a care coordinator. Okay. It may be that you can only see it if you have the lead agent, if you only have a supervisor role. So I don't know that I have enough information in any of our staff to do it, but let's try it. Okay. If nothing else, we could do 40285. So see, as a care coordinator, I can't see that information. I'm thinking you can only see it if you're a lead agent, if you're a supervisor. So
Yeah, I am logged in. I am a supervisor and I am logged in to production and I'm
you
still
can't
not
see it.
finding it. Mm-mm.
Okay. So, yep. You'll see there's a relationships section here.
Yeah, do you know where that pulls from? Because what I'm finding is that's blank.
Yeah, some of it may be blank, and from time to time you'll see supervisors in it. So, yep, it's only as good as the information that is in it. You're correct about that.
Okay. Is that pulled from somewhere or does the agency need to add that in? I'm just curious.
You can edit it based on the list of people in your agency if they have access. It was originally loaded as part of onboarding if agencies provided it, but it doesn't give contact information or anything else. So, yeah, to your point, will it be effective or not for contacting? I would need to give some more thought to, is there another way to do that from a courtesy standpoint? And I have the whole courtesy practice on my list of things to look at. So I'll just add that piece to it.
Thank you.
Yep.
All right, the next question comes from Heather. Your line is unmuted.
I just have a question about the recertification process. We have workers who are now coming upon that, and just looking at the guidance on the webpage wasn't terribly helpful, and just wondering if there's going to be some updated guidance on that, or I guess any information to share.
So the partner link document was taken down at one point because we were going to do some updates. Then it has not been put back up. Specifically, is the question about what can be considered recertification CLUs? So, like, what specifically is the question?
I think maybe yes. And then, I mean, for those folks who are actually in, the revised system now, is it going back to do some of the old training again, or,
No.
yeah.
So what recertification documentation says? So I believe in the MnCHOICES new mentor training, there's a module on being a MnCHOICES assessment mentor that might be worth looking at. But what the documentation basically says is that they need 12 hours of CLUs in person centered. The remaining, whatever 45 minus 12 is, 33, need to be in areas that support their practice. The recertification module itself gives instructions on how to complete CLUs. So the first time they take a they use that MnCH 8020, it will say to them, they'll have to take an introduction course that will tell them how to enter their CLUs into the system.
Yep.
So that'll give them that piece of it. And then it's our recommendation that they enter their recertification CLUs all during the year as they're getting their training done, so that they're not trying to enter them all in 2 days before their recertification or before their certification lapses. So because those certification CLUs have to be within the dates of their certificate. And so if they are inside the date of the certificate, TrainLink will accept them. If they're outside of the dates, it'll say, nope, can't enter that one. It doesn't meet the date requirements. So they need to pay attention to that as well. But this is on my list to update. We're having some policy conversation that needed to be reconciled, and now it's reconciled. I can repost this.
Okay. Good deal. Thank you.
But when you think about it, and remind your staff that if it supports their work as a certified assessor, makes them a better certified assessor, both in person-centered practice and other, they can include it in their CLUs.
Perfect. And we just are, I think we're just going to start a folder to keep their extra documents on file, but as long as it's in TrainLink too, right? They're good.
Yes.
Okay.
And so what you see in here is just a little bit. So there's I agree with you. Keep them as paper too, so you have them. So if for some reason something were to happen in TrainLink, there's a way to fix them. And then we're looking at, is there other ways to save that data somewhere else, so if for some reason it's lost, they don't lose it and have to start over. So we're
Okay.
problem solving that as well.
Perfect. Thank you.
Yeah. So we only have about 3 minutes left.
Yeah, and we only have one more hand raised, so maybe we can get to the last question.
Great.
Jennifer, I'm going to unmute your line.
A quick question. I just happened to see on your platform that you had up that you have messages. When is messages going to be starting? Because that would be nice so that I can message or when I find out when my case aide does something, because it just helps with the workflow. It would be really nice if we could start using that. That's all I have. Thank you.
I believe messages are available in production currently. Am I in error about that, folks? People might not be using them, and the other piece is it's only as good as people pay attention to them. You see, I have them because sometimes people practice and they send messages to me because they know my number because of training, and then I'll send them a message back that says, hey, I got your message. So you could test it, try it out, send a message to one of your care coordinators and have them, or sorry, case manager, I think you said, and have them see if it comes in. And then also always remind them to actually go to their messages itself to see what messages are available. So you can see people have sent me messages. Can you see this? We're testing it. And then this person specifically, when they were training, asked me about the HRA, and so I sent a response back. So we are at time. Do you want to try to take Jessica and then quick wrap up, or do you want to end now, Kia?
Oh, I don't know, Jessica. I mean, we can try to see if we can get to her question. I'll unmute your line.
Yeah. We only have a minute, so.
If you use it, it's very helpful. Like, so it comes up very easily. So you know you have a message. And so like I've seen it, like I used it because somebody didn't close an assessment. And so I was like, can you close this? And so
so you're saying messaging works in prod. Yep.
Yes. It didn't close the assessment, but it did help. They did respond to me. So yeah, it is helpful, and it does work, and it was lovely. And you can also, if the manager, I mean not the manager, but like if the manager, if the manager is loaded, sometimes you can also see that in the I'm blanking. You know, like where you assign yourself, you can see the managers there too if they're assigned.
Okay. Oh yeah, because it would say if they had a supervisor in the person record location, you would see staff you would see the staff assigned, and you could see lead agency supervisor. So
Yeah,
thank
but
you.
I mean,
That's a good tip as well.
Yeah, that's just like they obviously they have to be assigned, so then they have, you know,
Right.
So that's like an easy place if they're doing it properly. So that's where I look first. But
thank you. We appreciate the tips. So I need us to end today's call. I just have to say I'm so thankful for the conversation today. It was such good conversation and was so useful. We are looking for your pre-submitted questions, and currently in the Revised MnCHOICES application page, we have this Revised MnCHOICES application link, and if you click on it and choose other, then you can say that you're putting it in for the MCO call-in session for April, and then we can pull those questions and add them to the PowerPoint to help people see in writing the answers back. Kind of got to the whole Q&A piece. It would be a way to have a document that you could go back and look at. So please feel free to use that. I'll pull it about 2 or 3 weeks prior to the April call-in session. So that gives you a sense of timing, especially if you think like, oh, I've got questions now I'd ask. You should be able to click on this link in the PDF, but it's also on the Revised MnCHOICES application training page. This link exists, or the Revised MnCHOICES application partner link page, it also exists. So I just want to take a moment and say things are archived if you want to listen to them again. And then lastly, I wanted to make sure that we said thank you. Thank you everyone for attending today's call. It is very much appreciated. We appreciate your tips and your thoughtful thinking, and we look forward to speaking with you again in the future. So I'm going to put myself on mute and I'm going to leave, and thanks everyone.